Hello and welcome to Epidemiologic Concepts, Odds Ratio and Attributable Risk. The learning outcomes for this presentation will be to 1. Understand the two measures of data association in epidemiology, an odds ratio, OR, and attributable risk percentage, AR. 2. Understand how both ORs and ARs are calculated, and what each value means in terms of connecting cause, behaviors, exposure, with effect, developing disease. And 3. Understand the importance of each type of measure to the fields of health promotion, health education, and epidemiology. An odds ratio is a measure of association between an exposure and an outcome, or what is the risk between engaging in a specific behavior and developing a specific condition or disease. Odds ratios are represented by a number to quantify the risk or association between the two variables, such as the examples listed on this slide. Attributable risk is a measure of association between an exposure and an outcome among groups of people. Attributable risk association are also represented by a number to quantify the risk or association between the two variables, such as the examples highlighted on this slide. It is important to remember that an odds ratio quantifies associations between individual behaviors and risk for morbidity or disease, while attributable risk establishes associations between individuals exposed to a condition or risk factor versus those not exposed to a condition or risk factor. ORs are calculated by looking at the odds that cases have the disease were exposed to a specific condition versus whether controls, not having a disease, were exposed to the same condition. The image on this slide measures the association between eating ice cream and developing a food-borne infectious disease from it and shows how to calculate it. This slide illustrates the numerical classifications for odds ratios. Odds ratio values greater than 1.0 are associated with increased risk from a behavior relative to contracting a specific condition or disease, while values less than -1.0 are associated with decreased risk from a behavior relative to contracting a specific condition or disease. Finally, values greater than 0 but less than 1.0 are not associated with a behavior relative to contracting a specific condition or disease. This slide illustrates how to calculate an attributable risk percentage compared to how to calculate an odds ratio with the same dataset. Analyzing the data indicates that people who smoke have a 6.6% higher likelihood of developing bladder cancer versus those people who don't smoke. This slide discusses a practical application of OR and AR data specific to the coronavirus and mask-wearing recommendations. Odds ratio and attributable risk research has largely yielded the conclusion that mask wearing is positively associated with not spreading COVID-19. This research has informed public health guidance in recommending mask wearing for higher infectious of the COVID-19 pandemic. This slide presents concluding points discussed in this presentation. Both odds ratio and attributable risk yield numeric values of association between behaviors and/or exposure to a given illness or disease. For odds ratios, positive numbers greater than 1.0 are known to be associated with harmful or risky behaviors relative to a given disease, while numbers less than 1.0 are known to be associated with protective or beneficial behaviors relative to contracting a given disease. Meanwhile, attributable risk calculations are largely looking at percentages of risk gained by exposure to specific condition relative to populations not being exposed to a specific condition. Thank you for watching and have a great day.